Hello, for those who don't know me, Dr. Rafiq Odib, OBGYN, specializing in women's health and laparoscopic surgery for benign indications. And I'm going to start off by saying why are we making this video, and then I'm going to go over some things that you may or may not have heard in the other videos from the other doctors. But I'm also going to have an emphasis on questions that I keep getting related to pregnancy and COVID-19 and what to know and what not to worry about and what to worry about. So first of all, why? The reason this whole video even came to be is the other doctors that presented, as well as myself, were confronted, day in and day out by members of the community, our lovely Syrian American community, who want to do the right thing, but at the same time, they're very confused. They hear one thing on the news one day, they hear something else the next day. Social media is filled with misinformation, and at the end of the day, just like with everything else, whether it's nutrition or politics or whatever it is, when you keep getting mixed messages, people just throw their hands in the air and they just keep living life as usual. And that's very dangerous in this situation. Those of us on the front lines can tell you firsthand that you need to take this seriously. And it's not so much about you, but it's about protecting the healthcare workers that need to be protected, because if we're not protected and we get sick and we can't go back to work, then when you come into the hospital or your family member comes into the hospital, we can't take care of them because we're not well enough to take care of them. So let's go over some pregnancy specific things. It's very limited information so far, and this is developing so rapidly. What we knew a week ago or a month ago is considered outdated. So by the time you watch this video, and today is what, March 30th, by the time you watch this information might be outdated. We may even need to make another video after this, who knows? But let's go with what we know so far. Now, in terms of COVID-19, what is COVID-19? I know one of the other doctors, Dr. Abdelhai, went over this, but again, in pregnancy, things could be a little different. So we know that COVID-19 is a new illness that affects the lungs and breathing. And, you commonly hear about, do you have fever? Do you have cough? Do you have trouble breathing? But in pregnancy, because a lot of the symptoms of pregnancy specifically overlap with symptoms of COVID-19, it's very easy to discount these symptoms as, oh, you're just pregnant, don't worry about it. Now, things that are particularly, maybe not unique to pregnancy, but you may see more in pregnancy if you get exposed to COVID-19 or you're COVID-19 positive. And that is stomach problems such as nausea, diarrhea. Some people even report a loss of a sense of smell or taste. Now, it's important to know that symptoms could appear 2 to 14 days after you're exposed to the virus. So this really comes into play with the whole social distancing that you hear us telling you about. Staying inside your home, I know, can drive you crazy, but it's crucial. And it's crucial because although you may not feel anything out of the ordinary, you think the other person is healthy and well, you could, in theory, come in contact with this virus and then not notice anything out of the ordinary for 2 to 14 days after. And think about all the people that you've come in contact with in that 2 to 14 days that now you've potentially spread that virus out. Now, how does COVID-19 affect pregnant women? Current reports show that pregnant women do not have any more severe symptoms than the general population, which is relatively a good thing. But we're still learning how the illness affects pregnant women because the data is so limited. There was a review of 38 women where we did not see any evidence of what we call vertical transmission, or if a patient tested positive while she was pregnant, she wasn't at an increased risk of transmitting the virus to her baby while she was still pregnant. But at the same time, we're still urging pregnant women to take the same steps as the general public to avoid the coronavirus. We still have not had any maternal deaths secondary to coronavirus in pregnant women, thank God. Things that you need to be aware of. We do have a higher incidence of preterm deliveries in patients that test positive. We think that it's not so much from, the virus itself causing women to go into preterm labor as much as it is pregnant patients who get sick from the virus have to be delivered earlier than being, before they hit term, remote from their due date, just because they're sick, and if they don't get delivered, they have the potential of getting worse. Also increased risk of C-section rate, because if you get sick with the virus and the baby needs to, be delivered as soon as possible, there's a tendency to lean towards a cesarean delivery rather than inducing you, which could take sometimes a couple days. Now, let's talk about what should pregnant women do to avoid the coronavirus. A lot of overlap with what you heard with some of the other doctors' presentations. You guys know you're supposed to be washing your hands with soap and water for at least 20 seconds. Cleaning your hands with hand sanitizer that has at least 60% alcohol if you can't wash them. Avoiding touching your eyes, your nose, your mouth. Staying at home as much as possible. If you ask me, that's the most important after washing your hands. And then if you have to be around people, if it's work related or you're a caretaker, keeping that 6 feet distance from other people. And the reason for that is if you cough, the thought is the cough will produce the droplets that after 6 feet should drop and won't make it to the other person's face for them to inhale. And last but not least, avoiding people who are sick. Might seem obvious to you, but very important. Now, how does COVID-19 affect a fetus? COVID-19 affecting a fetus is too early for researchers to know, but just like I said earlier, as of right now, we don't have cases of mom transmitting to baby while pregnant, but we don't know if it could be passed during labor. We think that labor could cause the woman to express those droplets in a fashion that when the baby comes out, the baby does get exposed to those droplets, but it's still too soon to say. We have had one instance of a newborn die so far from COVID-19, but they don't know if the baby got it from the environment. Did the baby get it from one of the caretakers that was positive or exposed? Still too soon to say. Now, what should pregnant women do in terms of wearing a mask? So the mask controversy, I get this question all the time. And to be honest with you, there's even confusion, on the medical front line. This is what the CDC says, this is what the WHO says, this is what other countries are telling us they learned, and sometimes those things don't all align in terms of recommendations. As of right now, we're recommending that pregnant women who are feeling well, you don't need to wear a mask. If you have COVID-19 or you have symptoms concerning for COVID-19, then absolutely wear a mask when you're around other people. And then you should also wear a mask if you're taking care of someone who has COVID-19 or has symptoms suspicious for COVID-19. As the virus spreads, it's a good idea to talk to your OBGYN and see if you can switch your in-person visits to telephone visits. I've been doing a lot of visits over the telephone because a lot of times things can be done over the phone during pregnancy. Now, you can't go extended periods of time without hearing the baby's heartbeat, checking your blood pressure, getting your belly measured, that sort of thing. So each doctor and each hospital is coming up with their own system to do those things without potentially bringing the patients in and exposing those patients to a sick population. So talk to your doctor directly. Now, again, you may or may not have heard this in the other recordings, but how can I stay physically healthy right now? We know eating healthy, exercising regularly, getting plenty of sleep, and what you should be doing already while you're pregnant, avoiding tobacco, alcohol, drugs, hookah. That shouldn't even be a part of your life if you're pregnant. If you ask me, even if you're not pregnant, but that's a whole nother subject for a whole nother day. All right. Now, in terms of managing stress and anxiety, I know Monique is doing a great talk on this because everyone is stressed out with all the negative inputs we're getting between the TV, social media, what have you. But it's going to be really important when you're pregnant. The hormones of pregnancy can really, really throw you off balance, and it's crucial that you maintain your mental health at all times, but especially during pregnancy, because we know that if your mental health is not stable, we get concerned about increased risk of preterm labor, We get worried about growth of the baby. We worry about postpartum depression, which could impact baby bonding after delivery. So it's important that you stay connected with your friends and family over the phone, online, taking breaks from coronavirus news and social media. I'm guilty of this as well. I want to stay up to date with all that's coming out. But at the same time, I have to recognize when I'm getting overwhelmed myself and it can be a bit too much and I need to take a break, hang out with family, FaceTime a friend. And then if you're feeling sad or anxious, please don't brush it under the rug. It's crucial for you to talk to your OBGYN or other healthcare professional. Traveling while pregnant, you obviously have to check the CDC guidelines in terms of, where it's safe to travel. There's different viruses, not just coronavirus that we're always worried about during pregnancy. We just got done with a pretty bad Zika virus scare. But the general recommendation is if it's not essential travel, it's not crucial travel, if you can avoid the travel while pregnant, please do. What should I do if I'm pregnant and I think I have COVID-19? Now, if you think you've been exposed and you have a fever or a cough, call your doctor first. The last thing I want you to do is drive to the hospital. Call first, let them know what's going on. They'll tell you whether it's worth you coming into the hospital and potentially expose yourself if you haven't been exposed already. Calling 911 or going to the hospital right away are still important things that you need to do, but I would reserve that for if you're having a hard time breathing, you're having shortness of breath outside of what's been normal for you during the pregnancy, pain or pressure in the chest, suddenly you're confused, family members are saying you're saying things or doing things that don't quite make sense, being unable to respond to others, blue lips or blue areas of the face. Those do require immediate transportation to the hospital. Now, I really hope this is not something that you even have to worry about, but what should you do if you're pregnant and you're diagnosed with COVID-19? Follow the advice of the CDC and your doctor. Now, what is the current advice? The current advice is stay at home, except if you require medical care, meaning not everybody with COVID-19 has to go to the hospital. Avoid public transportation. That includes Ubers. You don't know if those Ubers have been sterilized. Separating yourself from other people in the home, very important. Now, if you're a mother, you've got children at home, husband's at work, you test positive, you're going to need help. You're not going to be able to do this on your own and then potentially get the kids sick, and then it's just going to spread. And then, like I mentioned earlier, wear a face mask when you are around other people or when you go to get medical care. Now, will this change anything in terms of your labor and delivery plans? It can. Each case is a little unique. Depends on how far along you are. Depends on if you have any medical problems during the pregnancy. Depends on how sick you are. But just want you to know that if you do test positive or you're a person under investigation for possibly getting exposed, it does not mean you have to have a cesarean birth. So I don't want you to worry that that is a concern. Now, this question has becoming a little bit more common than usual, but it's would it be safer to have a home birth? In my practice, we still believe the safest births are the ones given at the hospital. In case you need emergency assistance for one reason or another, being at a hospital is still considered safer when it comes to delivering a baby. My opinion, as well as the opinion of the American College of OBGYNs, that provides the guidelines that we abide by. Now, will COVID-19 pass to a baby through breast milk? So far, the virus has not been found in breast milk, but there's not enough information yet on whether women who are sick can pass the virus through breast milk. We know that breast milk gives babies protection against many illnesses. It's also the best source of nutrition for most babies. If you still have questions, talk to your doctor directly, but as of right now, we don't have any information that the virus is transmitted through the breast milk. Now, how can I avoid passing COVID-19 to my baby, my newborn baby? So if you have the symptoms or if you've been diagnosed, back to what I said earlier, washing your hands before touching your baby, wearing a face mask while breastfeeding, washing your hands before touching any of your breast pump supplies, baby bottle, cleaning the pump and the bottle frequently, okay? and make sure that nobody who's sick goes around your newborn baby. I know that sounds obvious, but you'd be surprised. Now, I want to wrap up the pregnancy-specific questions there. I believe Dr. Abdul Hai is going to put this online in a way that if this inspires you to ask a question that just wasn't addressed either in my video or in any of the other videos, I will get the question, I will get the answer back to that person. I'm personally not active on Facebook, so if that is going to be the medium of people exchanging information, I will depend on some of my colleagues that will be reading the questions on the Facebook forum. But in the meantime, please, 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 I beg and plead for you to stay home. It's not that long of a time we're asking you to stay home, if possible. There are some circumstances where you can't stay home. I get it. But if you do get that invitation to that, gathering at someone's house, or if people still are planning parties and birthdays and baptisms and all of this, please do the right thing. Politely decline. Many of us are canceling our birthdays and our big events and our graduations, and it breaks our heart. But you know what would break our heart more? Unknowingly spreading this virus to those that we love, or to the doctors and the nurses that we need to help resolve this crisis. If you forget everything I said during this video, the only thing I want you to remember is, please stay at home, except for the occasional walk around the block. I wish you nothing but the best. God bless.